Hi friends, we are going to see more about prioritization, delegation and the staff management. Here, we are going to see first the prioritization. Prioritization is an important aspect when we are deciding in a question of NCLEX types. We need to see whether the question is emphasizing the patient is the most sickest or he is the healthiest. We should always check with the question what the question is stating. If it is the sickest, then the patient is the most priority. And next one is we are seeing most of the factors in the question like age, the gender, the diagnosis and the modifying phrase. For example, a 10-year-old male patient who is having hypospadiasis and he is having vomiting, who is throwing up bile. Here, the age and the gender doesn't matter. Even the diagnosis doesn't matter. The modifying phrase is who is having vomiting and throwing up bile is most important, and this goes for priority. Why a hypospadiasis patient should vomit? We should always question in such a way and we have to arrive for the answer. And then, as I said, the diagnosis and the modifying phrase is most important. The most important is the modifying phrase, because the modifying phrase will tell what is the actual problem the patient is facing, and we can arrive at the answer and we can choose the correct one. Next, we can see the 3 rules of prioritization. As I always said, acute always beats chronic. Acute patient is considered to be the acute condition, whereas the chronic patient is a long-standing illness because it is already the patient is having that problem since such a long time. Acute is in sudden onset. For example, a patient with pain in abdomen cannot be neglected. It might be a pain of because of pancreatitis, or it might be because of acute bowel rupture. So we need to emphasize what is the important and what is the priority. So the acute always beats the chronic patients. Next is the fresh operative patient who is in the first 12 hours is considered to be the most priority when compared to the other patient, other surgical condition or the other medical condition, no matter what is the condition. So this patient, that is the first 12-hour post-operative patient, are considered to be most priority. And next one is the unstable versus stable. Unstable patient is always considered the most priority when compared to a stable patient. Unstable patient might have any condition, they might collapse. So we need to intervene, assess, and we need to implement what we need to plan and implement what has to be done exactly with that patient. So this patient stays in the priority list. So when coming to the stable patients, what are the things we need to emphasize more? We should see the word stable, which is mentioned in the question. So the chronic illness makes you always stable. If the question is saying the patient is stable, or the option is saying the patient is stable, so we need to eliminate that particular option. And always the post-operative patient who is more than 12 hours of post-operative period, out of the post-operative period, he is out of the danger, and this type of patient is considered to be stable. And if the patient is having any anesthesia which is of local or a particular regional type, this type of patient is considered to be normal, but we should always go with the modifying phrase, what the question is stating when selecting the answers. Next one, the lab abnormalities, which is important with such patients which is involving the vital organs such as the potassium, the blood sugars are more important when comparing to the other lab values such as which is of least priority, such as chloride or magnesium, which will have which can wait. If important potassium values are coming very less, means the potassium value is falling below 3 or 4, they have an immediate effect on the body when compared to the other electrolytes such as chloride or such. They will give some time for us. And even in case of glucose also, if it is falling, we need to prioritize and we need to manage it immediately when compared to the other electrolytes. And we should always see the phrases such as ready for discharge and who is the patient is to be discharged or admitted longer than 24 hours ago. These type of phrases we need to emphasize in the question or in the option to just eliminate it. Next one, if the question states or if the option states the patient is not having any changes in the assessment, this is also need to be eliminated. And next one is experiencing the expected signs of a particular disease condition or a particular diagnosis is considered to be as a bit stable. with which they are diagnosed. Example, a patient with the gastritis having a mild abdomen pain is considered to be normal. If the same thing, if the patient with gastritis is having a dizziness or a headache, we should see what exactly, why he is having headache or dizziness. We need to see this is something which is away from the expected symptoms. So we need to see such type of symptoms and identify in the questions. Next, we are coming to the unstable patients. What are the things we need to monitor or we need to emphasize in the question regarding the unstable patients? If it is saying any acute illness, it is the most priority. You need to select that particular answer. So you should not forgo that particular option. And the word unstable in any option or in any question will alarm you, and we need to go with the content and we need to see what is the answer need to be selected. The post-operative patients who is less than 12 hours in the duration after the surgery are considered to be most emergency, because they might be having the after effects of anesthesia which will affect the airway pattern or something which is hemodynamically they are being affected. So we, in this initial 12 hours of time, we need to emphasize on their vitals and we need to monitor them very closely because they are considered to be unstable patients. And general anesthesia is again important phrase we need to monitor or we need to emphasize in the question to see whether the patient is in general anesthesia, then this patient is obviously unstable. So these general anesthesia might affect the hemodynamic stability of the patient. So these type of patients also need to be emphasized more importantly. And the lab abnormalities of the C and D patients, that is, I was saying the important lab values such as potassium, the glucose and the sodium. These are the important electrolytes which maintain the hemodynamic stability of the patient. If there is a little bit deranged in these electrolytes, might impair the physiological status of the patient. They might throw up seizures or they might throw up some cardiac arrhythmias. So we need to see such type of electrolytes and to be monitored immediately. And the phrases which states in the like not ready for discharge or newly admitted patients or newly diagnosed or admitted less than 24 hours, these type of phrases we need to emphasize from the question. So these type of phrases are also considered to be unstable. So we need to see all this type of phrases whether it is being present in the question when selecting the question from in the NCLEX type of questions. And the patient is experiencing any unexpected signs and symptoms which is not related with the diagnosis. So these type of unrelated signs and symptoms are considered to be very emergency, and they are really absolutely unstable type of patients. And always there is any change in the diagnosis from the initial diagnosis, or there is a relatively changing diagnosis which keeps on happening with the patient, these type of patients are also considered to be unstable. Next, we should always see that unstable patients are regardless unstable, or whether it is expected or not. Why? What is expected or not? We should see those things. Like hemorrhage. Hemorrhage, there is a difference between a bleeding. A bleeding, if it is of small cut, it is not of much importance. When we are comparing hemorrhage with a bigger artery or a major cut, this is an alarming and this stands more emergency. So these type of patients needs to be attended at the earliest. And a fever of less than 1.5 degree of Fahrenheit is not considered to be urgent. And similarly, if the fever of 105 degree Fahrenheit and above is considered to be emergency, because they are having hyperpyrexia, which is having very much danger to the brain tissues, because they will not supply glucose to the brain cells, and the brain cell may suffer injury and they may throw up seizures, and it will lead to serious complications. And another type of patients who are pulselessness or breathlessness, if it is unless and until it is witnessed, they are considered to be very emergency. If you are already witnessing pulseless and breathlessness, I don't think so they are much of priority. So if you are not witnessing, if they are pulseless and breathlessness, then obviously they are at the priority list. And if they are already dead, then they are not the priority again, friends. Next one, which is the tiebreaker. The more of vitals the organ, the higher is the priority. The organs we are talking about is the modifying phrase which they are present in the questions and not the diagnosis itself. So the modifying phrase, what are the organs involved in the modifying phrase? We need to emphasize, and they comes in this priority list. Like order of organs like brain, the lungs, and the heart, the liver, the kidney, and the pancreas. We always know the brain, we need to, in any case of emergency, the brain needs the oxygen in initial 1 to 4 minutes of cessation of breath. So we need to initiate the CPR, that is the chest compressions, along with an airway breathing and circulation. So always these type of organs may play a very important role in re-establishing the patient's stability. Like important organs like brain, the lungs, and the heart, that is the ABC, plays a very important role as usual. And other organs like liver and kidney and pancreas also plays very important role when selecting in the priority list. Next, we are coming to the delegation. Delegation is an important aspect in the NCLEX questions, because the NCLEX never forget to test from these aspects. So delegation again plays a very important role in the NCLEX journey when preparing with the questions. So we are going to see the delegation of the licensed practical nurse. What are the things we need to delegate to the licensed practical nurse? Here are the few things we need to delegate to the licensed practical nurse. We don't delegate the following responsibilities to an LPN. That is, starting in any intravenous medication, because they are not allowed to assess the intravenous site of the patient, or hanging or mixing any intravenous medications, they are not allowed. And again, pushing in any intravenous medication, but they can maintain in the charts and the document what is the flow rate that is being maintained. And they cannot administer blood or miscellaneous blood products via the peripheral line or the central venous line or the central venous catheter. They cannot even flush or change the central line dressing unless that is the only option they can do. And they can't plan a care for the patient, but they can implement when being delegated from a registered nurse. The particular care plan, they can implement what has to be done. And they cannot again create any nursing care plan. They don't have any rights. You heard it right. Next one, they cannot perform any task which is involving in developing or teaching plan. But if it is already been taught by a registered nurse, they can only be reinforcing it again. And they can't care any unstable patients which is out of the scope of practice. They can only care for the stable patients. And again, they cannot do any fasting of anything. Maybe the initial assessment, initial admission. So these type of tasks are being carried out by the registered nurse, because they are only entitled to do any first thing of any type of patients. They cannot do admission, they cannot do discharge, they cannot do transfer, they cannot do any initial assessment after a patient changing conditions, because they are only being entitled by a registered nurse. So next we can see what are the delegation of an unlicensed assistive personnel or the nursing aid. These are the few delegation which are under this UAP. We cannot delegate the responsibilities such as charting. They cannot do any charting, but they can only chart with vitals, or they can only check the blood sugar levels. And they cannot give any medications also. They can only do some topical creams or some barrier creams. And that they can do treatment such as enema or catheterization if it is the only last resort they are left with. You cannot. They can only do the activities of daily living such as ambulation, bed making, helping the patient in daily living tasks, eating, bathing, all these things. They can assist them in all the daily living tasks. and we cannot delegate any patient safety responsibilities to them because they are not authorized to do such. And for example, we cannot do taking of the restraints in the room where there is a sitters in the or the caregivers in the room. We cannot delegate to do any safety thing to them. They can only do the safety of the sitters who are with the patients. They can only do what you teach to them to do, and you should also document what you taught them to do to the patients, right? So these type of tasks we cannot delegate to the even the patient attendants or the sitters who are attending the patients, that is which is related to the safety or which is related to the implementation of anything, right friends? Next, and the important delegation aspects of the registered nurse is they can do all the activities which is related to ADPIE, that is ADPI assessment, any initial assessment during the admission, during the transfer of a procedure on an unstable patient. They are always authorized and they are deemed to do it, and they are entitled to do all type of injections, medications. They can administer the blood products, all the task of RPN, that is the LPN, the UAP, and they can do the implementation, assessment, and next one is the diagnosis. They can diagnose the particular condition immediately, what is the patient is facing, and after diagnosis we need to plan a particular thing, what actually accordingly can be planned for that particular disease condition. And next one is after appropriate planning we need to implement what implementation, what are the steps, what are the things we can be done to elevate or particular pain or particular thing away from the patient. Assessment, diagnosis, implementation, and next one is planning, and next last but not the least is the evaluation and the education. Education is always dealt by the registered nurse because she is most knowledgeable and she is well versed in this topic, and she is having a vast knowledge and experience in this particular topics. So she need to give health education to all the patients who are getting admitted or who are going to discharge or the home health care setup. She is entitled to give health education and evaluation. Of course, she need to see what exactly can be done if the particular things what she is implemented is being achieved, or evaluation will bring her into a conclusion whether the patient is being seen or been looked after in all the aspects, or if not then reevaluate what are the things need to be re-implemented and need to be planned and implemented so as to give the patient the utmost comfort and the safe environment to the patient in an hospital setting. Most important delegation aspects if for a registered nurse. Next, we are moving to a very important topic, that is staff management. Staff management plays a very important role in the hospital scenario. We need to deal many things how we should handle to an appropriate behavior. It is among the staff themselves. First, few things we are going to see here is how we need to handle the appropriate behavior among the staff. So there are always 4 answers in this. If we are seeing some unrelated behavior with the staff members or with the colleagues, first thing is we can always tell to the supervisor. Second thing is we can confront them. And third thing, take over immediate later or talk to them about it in a private situation or ignore the behavior. These are the 4 things we need to see. Anything which is not accepted from your colleagues. First, ignoring the behavior is not always the right option. Okay, ask yourself if they were doing anything illegal, like if they are abusing a drug, if they are picking any medicines or they are hiding any medicines. So we should check if they are doing anything illegal. If yes, choose, tell the supervisor. This is the first thing. Always, this is the answer in the question. First, we need to tell the supervisor. We need to always move in our channel of communication, because we can only tell to our supervisor. We cannot tell any of our problems related to any other doctors or the head doctors, because we are in the channel of communication with our head nurse or with our nursing supervisor, because we come under them. And if after telling the supervisor, or if you are telling something no, let me ask yourself if there is any immediate danger from that particular person, from your colleague, in the ways of physical or psychological harm to that particular patient. If yes, then confront them immediately and take over from them and send them. Right? Next one is, if no, if there is no harm from them to the patient's physical or the psychological aspect, then it's not appropriate, then, or legal, or not in a harmful behavior, then choose, approach them later and talk to them later in a private setup. Or if it is harmful or illegal, just confront it first, tell that you are doing wrong and immediately report to the supervisor. Right, friends? Thank you. This is all about the staff management, the delegation and the prioritization.